Obviously, the youth mental health crisis cuts across all socioeconomic, racial, gender lines. But are there particular stressors on low-income families and on low-income communities when it comes to mental health?
Absolutely, and I'm glad you asked, Jim, because families who have been traditionally marginalized, right, communities of color, families who tend to be on the lower end of the socioeconomic spectrum, who don't make as much money, they have additional stressors that certain other families don't have to deal with. We know that economic stressors at home do impact children, right? Like we know that when parents are stressed because they're worried about losing their job, that certainly is something that kids often feel. But we know that those economic stressors can also impact a child's food. You know, we know food insecurity is a big issue,
Absolutely.
like in America right now, which is one of the reasons why schools are so critical. So when those stressors are increased, the mental health of children and parents is a greater risk. And that's why it's so important as we think about mental health to recognize that it is deeply tied to the basic supports that we provide family. You know, I say this as, you know, as a child of immigrants who came to this country with a fierce belief, like in the power and the promise of America, and who still have that, that we are a country where no child should have to go hungry, where people should not have to worry about their ability to feed their family. It's not to say that people shouldn't be working hard, that they shouldn't be contributing to society, absolutely, but we have enough as a country and that we should be able to ensure that those basic needs for food, for shelter, for healthcare when you're sick are met. Because those three areas in particular, when you don't have food, you don't have a home, and you don't have the ability to get care when you're sick, these are three extraordinary stressors in people's lives, and they impact children as well. You know, I remember as a child, when my parents came to this country, we didn't have much in terms of money or connections or anything. So we had to be very careful, you know, about how we spent money. And I remember once going to the grocery store with my mom when I was small, and I remember her saying, we have to be very careful about what we buy in the store because we have to make this money stretch, you know, over the entire month. And I remember being scared in that moment and worrying, like, wait, are we not going to have enough to eat? Like, what's going to happen? And I'm telling you this, like, decades later. Like, it stuck with me.
Totally.
Right? And so I really feel for parents out there who are in families who've traditionally been left out, who are struggling economically, who are living in communities where there's a lot of violence, right? Because, and whose kids are wondering how they're going to be protected. I feel for those parents because it's one of the most painful things as a parent is to feel like you can't protect your children. You can't give them what they need. And to feel that as a parent is just extraordinarily painful. So as a society, I do think that if we want to address the mental health crisis, yes, it's about providing more access to care, mental health care. Yes, it's about making sure we're investing in schools and in prevention programs and counselors. But it's also about making sure that the foundation of families and communities is strong so that everyone has the basics, food, shelter, access to health care. If they have that, that relieves a tremendous amount of stress on families. And ultimately, that benefits the mental health of kids and their parents.
You wrote a book about loneliness. Why did you write a book about loneliness, and how does it fit into the solutions we're talking about here today?
Jim, I wrote about loneliness in part to make sense of the world for myself, you know, because I was seeing several things come together. One, I was having all these conversations with people around the country when I was Surgeon General, where I had gone and asked a simple question, how can I be helpful? And I found that these stories were pouring out about isolation and about how people felt like they were on their own, that there wasn't anybody to help them with the burdens that they were carrying, that they were invisible, that if they disappeared tomorrow, nobody would care. And that really stuck with me, and it reminded me of my experience in the hospital as a doctor, seeing so many patients who were struggling with loneliness. They would come in for a pneumonia or a blood clot or a heart attack, and I would find that they often were alone as well. And even in critical moments where I would ask them, is there somebody we can call to be with you? Because, you know, we have to have a really tough conversation, you know, about a new diagnosis. So many times the answer was, you know, I wish there was somebody, but there isn't. And so that was on my mind. But my own experiences as a child were on my mind too, of feeling that loneliness and isolation, of knowing viscerally how painful that was. And I can still feel that. You know, I'm older now. I'm in a much better place. I'm blessed with family and with friends, and I'm so grateful every day for that. But I still remember how painful it felt to struggle with that loneliness, to walk into the lunchroom every day, the cafeteria, and wonder if there would be somebody to sit next to. So all of that was coming together to get me interested in doing more and understanding more about loneliness. And I'll tell you, Jim, when I dug into the data around it, it was so striking to see just how connected we are in terms of loneliness and our mental and physical health. So it turns out if we struggle with loneliness, we're at increased risk for anxiety and depression, but we're also at increased risk for premature death, for dementia, for cardiovascular disease. And it turns out that the mortality risk that's associated with loneliness is similar to the mortality risk associated with smoking 15 cigarettes a day. It's greater than the mortality risk associated with obesity. And as Surgeon General, I think about how much time our office historically has spent on issues like smoking, like obesity. But as a country, I don't think we've understood or invested in as much in addressing loneliness, which has profound impacts on our health. So that's ultimately why I wrote the book. It was to make sense of that, to share that with the world, because I felt that, and feel even more strongly now, that loneliness is a public health issue, and social connection is one of the most powerful tools we have for enhancing health and well-being for people everywhere.
That's such a beautiful way of saying it. Now, so we've been talking a lot about solutions, and you've woven in advice to parents, to educators, to young people. But if I gave you the magic wand, and actually you sort of have a magic wand because you're the Surgeon General of the United States, that doesn't mean you can automatically get everything you want. But let's summarize the key solutions that you see to tackling this youth mental health crisis in the United States.
Yeah, so I would say that, number one, when it comes to expanding access to treatment, that we have to utilize technology more effectively to get care to where people are. And that means not just in schools, but in rural areas and all parts of our country where access is a problem. Along those lines, we have to train more mental health providers, not just psychiatrists, psychologists, and counselors, but we have to support peer support groups and other sort of methods of providing people the support and the care that they need. And that's something, the workforce piece, that we've got to invest in. That's number two. I'd say another bucket to consider, though, is around prevention, right? And there, the third issue I would say needs attention is our investment in prevention programs. There are school and community-based prevention programs which we know work to reduce the likelihood our children will struggle with mental health concerns down the line. It turns out a lot of them are actually cost-effective as well. They return more money than what we invest in them. But you know what? Many schools don't know about this, and those that do don't have the money or the technical assistance to implement them. You know, I'm grateful that through the Safer Communities Act that was just passed, that we finally have some more money coming in to support mental health and well-being in our schools that builds on the early investment that was made, you know, by President Biden in the sort of the ARP bill and through other measures that he's proposed through his budget. But the bottom line is that those prevention programs are really vital. And, you know, there's no one I've met, for example, who's ever said, you know, I'd rather get diabetes and treat it rather than prevent it in the first place.
Right.
Prevention is always better than cure. We got to invest in those prevention programs. And finally, I would just say this. The investments we make in social connection are just really vital to supporting mental health and well-being. Yet many people are really struggling right now to feel a sense of connection. Depending on the studies you look at, more than 50% of young people are saying that they are struggling with loneliness and isolation. It's an extraordinary number of people. So thinking about how we strengthen human connection is vital, and that requires us, number one, thinking about technology and making sure that we are ensuring that technology supports healthy connections as opposed to contributes to isolation. But it's also about supporting community organizations and efforts in our schools to build that sense of community and connection. I think about programs like the Beyond Differences program that started right in Marin, not too far from where you are.
By my friends,
yes,
absolutely.
By your friends, by Laura and Ace.
And Ace, yeah.
And how that spread to community schools all across the country right now. That's a program that's helping young people help other young people to address isolation and build bridges to one another. So these are some of the areas where I think we could make an extraordinary difference. Some of them require policies to be passed. Some of them require investments to be made. But some of them also require each of us as individuals to simply ask, you know, what can we do to help others around us feel more connected? How can we check on people in our lives, make sure they're doing okay? How can we start that conversation with a young person in their life so that they know that even if they're going through a tough time, and especially if they are, that they are not alone?
But the good news is that this is solvable. This is something we know how to address. We need the will, the resources, and the commitment to do it. I have a final question for you about technology. So we've been talking both about the challenges that social media and technology platforms present to all of us, but particularly to young people. But it sounds like you're also saying that technology is absolutely part of the solution. Is that a double-edged sword, if you will, because we are living with
Yeah.
it 24/7.
Absolutely. And look, I think technology is one of the great gifts that we've had in the last several decades. It's allowed us to do so much more as a society than we were able to before. So this is not necessarily about tech being good or bad, right? Technology is a tool at the end of the day, and how we use it, how we design it, is what determines, whether it helps or hurts us. I think there are certain ways that technology can be helpful to build a community. It certainly can be helpful to help provide care to people, mental health care, to people at a distance. Those are great uses of technology. But we also know that when technology is not designed well, or when it's designed for purposes other than enhancing mental health and well-being, that it can actually harm us, right? If it's designed to pull more and more of our time and attention away, regardless of how well that time and attention is used, that's problematic. If it's designed in ways that force us to compare ourselves to other people that end up making us feel worse about ourselves, and they may end up making young girls feel worse about their bodies, that is problematic, and that is unfortunately what's happening to many young people right now. So I do think that technology ultimately is a tool, but it's a tool that has to be used well and thoughtfully, and the intentions have to be clear. I would love to see social media platforms that are designed with the intent of maximizing not just time spent on the platforms, but time well spent. Time well spent meaning time that contributes to positive mental health and well-being and a stronger sense of self, right? That's what we've got to do, is be conscious and thoughtful about how we use technology. Otherwise, the technology will harm us in ways, even if it wasn't intended, are still profoundly consequential to young people and to families.
Do you look at it as social media as a cause of the mental health crisis or a contributing factor? Sometimes doctors and researchers are careful about the way they frame stuff like that.
Well, I think that there are a number of factors, Jim, that have contributed to the youth mental health crisis today. I don't think it's one single thing. Right. I do think that for many young people, social media has been one of those contributors and has had a negative impact on their mental health and well-being. I think there are other factors as well. The negative information environment in which young people are growing up in, the online bullying and harassment that many are subject to, the violence in communities, the racism, the climate change, and the threat of climate change that young people are looking at. Those existential threats make them worry that the future is not necessarily brighter than the past. And also the loneliness that young people are struggling with today, which is not just a consequence of social media usage, but if you think about it, we have fewer and fewer reasons that we need to go out and interact with people these days. I can buy all my groceries, from my house. I don't necessarily need to go out to necessarily get mail delivered. I don't need to go out to get items from the store. I can just order them online. I just have fewer reasons that I need to engage with other people, which might seem convenient. But I worry at times that we've made a devil's bargain and traded convenience and community. And that trade-off is not necessarily one I think that has always borne out in our favor. So you put all these factors together, and it culminates in a profound crisis for young people. And one last thing to mention when it comes to these factors is the pace of change. It is true that every generation has had to deal with change. That's for sure. But the pace of change and the amount of change that we're asking young people to think about and accommodate in their lives is really dizzying and unprecedented. So I think we have to look at that thoughtfully and recognize that young people are facing a unique set of factors that are driving the mental health crisis that we're seeing. We may not always understand all of those factors if we didn't grow up with them, but I think it's important for us to approach them with empathy and to listen to young people, to give them a seat at the table when it comes to fashioning solutions. Because one of the many things that makes me hopeful, in addition to having a moment in time where so many people are focused on mental health, where we have bipartisan interest in advancing mental health policies, but what really gives me hope is that young people have a remarkable amount of insight into what's happening and to what they need. They just need our support in actually meeting those needs. But they are profoundly thoughtful, insightful, and are already providing invaluable leadership when it comes to addressing the youth mental health crisis.
That is one of the most interesting conversations I can recall having. And quite frankly, your wisdom, but also the constructive solutions you're talking about in the context of the youth mental health crisis in this country could not be more important for me as a parent, for all of us as parents and community members, and quite frankly, for the United States of America. Thank you so much for joining us today. I'm Jim Steyer, the founder and CEO of Common Sense Media, and we really appreciate your involvement in this conversation and hope that you will join me and Dr. Murthy and all of your friends and family and community members in tackling this youth mental health crisis, because together we can actually solve it. Thank you so much for joining us.